Friends, let me talk to you now about a very simple and gentle subject, at the same time, most concerning subject, most important subject, with whatever little knowledge that I have, and that's about the diabetes or what we call the diabetes mellitus in medical language. So, this diabetes is a disorder in converting the food into energy. And the three most common symptoms of the undiagnosed diabetes include the increased thirst, increased urination, and increased hunger. See, we eat food rich in different items, rich in proteins, rich in minerals, rich in vitamins, rich in carbohydrates, etc. And the proteins are required for the growth, the carbohydrates and the lipids, they provide the energy. Lipids means the liquids, they are required to provide the lubrication to the joints. The minerals and vitamins, they are required for regulating the chemical reactions in the body. The vitamins are organic compounds that are needed in small quantities to sustain the life. And different vitamins have different roles and they are needed in different quantities. And these vitamins, they are either water soluble or fat soluble. So the fat soluble vitamins, they are easier for the body to store than the water soluble. And the vitamins always contain the carbon. So they are called as the organic. They are described as organic. So now let us come to sugar. So when we eat food like white rice, candy, sugar, these cereals, white bread, cookies, the potatoes, potato chips, beetroots, the baked products, etc., etc., which are rich in sugar, which are rich in carbohydrates, our body turns it into a sugar called as the glucose and it sends that to our bloodstream. And our pancreas, it releases the insulin. Insulin is a hormone that helps to move the glucose from our blood into our cells, millions and millions of cells, which are the building blocks of the body, which use the glucose for energy. See, many cells group put together form a tissue, different tissues group put together form an organ, and many organs group put together form an organ system. So, this sugar is required for providing energy to these cells, again to these organs, organ systems, etc. And when we have diabetes and don't get treatment, our body does not use insulin like it should. And too much of glucose stays in our blood. So a condition usually called as high blood sugar. So this can really cause the health problems that may be serious or even life threatening. See, there is no cure for diabetes. But with treatment and lifestyle changes, you can definitely live a long and healthy life. And of course, the normal levels of blood sugar, they are, while fasting, it should be from 70 to 110 10 mg, 110 mg, 70 to 110 mg per deciliter. And 2 hours after the start of a meal, it should be less than 140 mg per dl. And the HbA1c, that is the average level for the last 3 months, for the last 3 month period, it should be less than 5.7%. And diabetes, of course, comes in different forms depending on the cause. And there are two types, namely the type 1 and type 2. So, coming to type 1 diabetes, it is also called as the insulin dependent diabetes because it often begins in the childhood itself. And it happens when your body attacks your pancreas with the antibodies. So the organ is damaged and it does not make insulin at all. So the insulin percentage is much, much, much less than what it is required. So your genes might cause this type of diabetes, and it could also happen because of problems with cells in our pancreas that make insulin. So many of the health problems that can come with type 1, they are damage to the blood vessels in our eyes, called the diabetic retinopathy. They damage to nerves, called the diabetic neuropathy, and the damage to kidneys, called the diabetic nephropathy. So people with this type 1, they also have a higher risk of heart diseases and a stroke. And treatment for type 1 diabetes involves injecting insulin into the fatty tissue just under your skin. So you may use syringes, you may use insulin pens that use the pre-filled cartridges and a thin needle. Jet injectors that use high pressure air to send a spray of insulin through your skin also is used. And a test called the HbA1c blood test estimates your blood sugar levels over the previous 3 months, and doctor uses it to see how well your blood sugar is under control. So that helps them to know the risk problems, the risk complications. So if you happen to have the type 1 diabetes, you will need to make changes, including frequent testing of your blood sugar levels, careful meal planning, daily exercise, taking insulin, and other medications as needed. So here you require more insulin to be injected. And in the case of type 2 diabetes, this is called the non-insulin dependent or the adult onset diabetes. But it has become more common in children and teens over the past 20, 30 years, and largely because more younger people, they are overweight. About 90% of people with diabetes have type 2. So when you have a type 2 diabetes, your pancreas usually creates some insulin, but either it is not enough or your body does not use it like it should. So the insulin resistance, when your cells don't respond to the insulin, it usually happens in the fat, liver, and also muscle cells. So this type 2 diabetes, it is often milder than the type 1, but it can still cause major health implications, especially in the small blood vessels in your kidneys, nerves, and eyes. So type 2 also, it raises your risk of heart diseases and stroke. So people who are overweight, 20% more than their target body weight, they have an especially high risk of type 2 diabetes and the health problems that can follow. So obesity often causes the insulin resistance, so your pancreas has to work harder to make more insulin. But it is still not enough to keep your blood sugar levels where they should be. And again, the treatment for type 2 diabetes also involves keeping healthy weight, eating right food. So generally poor in carbohydrates and exercising. And some people need medication too. So the doctor may also advise an HbA1c test a few times a year to see how well you have been controlling your blood sugar. And there is also what is called as the gestational diabetes. See, pregnancy usually causes some form of insulin resistance. If this becomes diabetes, it is called as gestational diabetes. So doctors often spot it in mid or late pregnancy because a woman's blood sugar, it travels through her placenta to the baby. So it's important to control the gestational diabetes to protect the baby's growth and development. So doctors report this gestational diabetes in 2 to 10% of pregnancies, and it usually goes away after the birth. But up to 10% of the women having this gestational diabetes may also develop type 2 diabetes few months after or even after a few years later. So it is gestational diabetes also is more of a risk for the baby than the mother, and a baby might have unusual weight gain before birth requiring a cesarean operation. So trouble in breathing at birth or a higher risk of obesity and diabetes later in life. Or it can even damage their heart, kidneys, nerves, and eyes. So gestational diabetes treatments, it involves careful meal planning again to make sure you get enough nutrients without too much of fat and calories. So daily exercise, keeping weight gain under control, taking insulin to control your blood sugar levels if needed. So this is all required. And a small percentage of diabetic cases may also be for other reasons like surgeries, medications, and infections. So this is all just what I wanted to, share with you in general about diabetes. So thank you, friends. Thank you very much.